This is a real strain on our healthcare system, and every indicator that we're seeing right now is this will be worse than it was last winter. Remember, we were at a peak of 361 patients at that time, and we're showing the possibility of going 400 to 500 inpatients or higher within the next few weeks. That will surpass where we were earlier, as I said. We're already starting to see wait times longer than we would like in the emergency departments. That's really because the number of patients coming into the ER or to the ED with COVID or with other illnesses are putting a strain on the healthcare system. Earlier this week, we had 100 patients waiting for beds. And if you just think about if we did not have the 125 COVID patients that were in the hospital, we'd have the capacity to assume those without having to stop surgery or other cases or other procedures. If we don't start to bend the curve back again, if we don't start to make and take precautions, we will see this getting much worse in the coming weeks. These COVID-19 patients require a lot of attention, a lot of love, a lot of resources that we provide to them every day in our hospitals. It's more staffing intensive, and it does put that strain on our frontline caregivers. This past summer, we made a very significant investment to our frontline caregivers to pay them higher rates so that we could reduce turnover numbers within our region. But simply put, there are not enough caregivers across the region or across the United States today to take care of all the patients that we're seeing with COVID. Many hospitals across the region are in the same, region and across the country, really, to that matter, are in the same crisis we are today. You may have seen reports that Indiana, Arkansas, Louisiana, Florida are also seeing very high census of COVID. Even in Tennessee, the western part of the state, seeing higher cases than they have before. So when we get full, sometimes what we have to do is transfer to other facilities outside our region. When we're all full like this, we have the inability to transfer patients, and we have to make room for them here. And the consequences of this pandemic can be very grim.